I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Morning, everyone. Welcome to the Monday, April 18th meeting of the Board of County Commissioners. My name is Shelley Bueller, and I have the pleasure of serving as chair of the commission alongside my colleagues, Commissioner Kevin Cook.
Good morning.
Good morning, Commissioner Bob Archer.
Good morning.
Good morning. And clerk, first item, please.
First item under proclamations, presentations, quarterly update from Vallejo. Bill Persinger.
Good morning,
Good
everybody.
morning.
How are you?
Good.
Thank you for having me. I want to start again with a couple of things. Thank you to the county for their bedrock and cornerstone support of public mental health these many, many years, and also to acknowledge a couple of our governing board members, faces you'll recognize, Dick Klein and Frank Henderson. It's a pleasure to be here. My time is yours. I'll try to keep it short, but I have all day. If you want to talk about mental health, we can try to do that. We appreciate the concern of the commission and the public for mental health, and in that and the interest in public mental health. And in that vein, we will endeavor to be up here several times during the year and make reports. You do have a written report there in front of you. And if I might just jog through the items real quickly. And if you need to, if you have a question, just give me a shout, and I'll pause and take care of that. On the financial side, and you do have an unaudited first quarter's report attached to this 3-page document. We've gotten together with our governing board's executive committee and the executive leadership of the Mental Health Center and come up with a good term, an austerity and opportunities plan. Kind of the immediate focus is the austerity. How can we save money? And we have managed to come up with quite a few ways to save some money and reduce our expenses, both in the short and long term. And as you may see as I go through the report, we're also working on some new partnerships out there in the community, which eventually, hopefully, will be a win for everybody in a lot of ways. But also like to acknowledge a couple of partners here, Brian and Alice, people that I've worked closely with in the 6 months that I've been here, and want to thank them for their support of mental health. So just a couple of examples. On the savings side, we put into place an electronic mileage system that allows staff who travel to enter their mileage, even if it's only a couple of miles across town. It selects the shortest route and pays on that. And I can't say today what we're going to save, but I think we're estimating the savings around $40,000 a year, which is about a half a day's operations. When I was in Emporia about this time last year, a couple of years ago, we put the system in place and saved over $70,000, but quite a bit more travel in that 7-county region. But a half day's operations is a pretty significant thing. On the support employment side, a couple of comments there. I want to say thank you to the members of JUMP. They've been pretty good partners here, in fact, excellent partners in terms of supported employment and taking on that cause and helping us find places where adults with mental illness can go to work and continue and have work be a part of their recovery. There's just been a great group of people to work with. We conducted a summit of employers here recently with JUMP's assistance and helped get the message out there about to employers who may be willing to take folks who have a mental disability and give them meaningful work. And so that's just been a great program. Also, that program is pretty highly rated state and nationally. Our local support employment service at the Mental Health Center, pretty darn proud of that. We are holding meetings with folks, the behavioral health staff at the Topeka Correctional Facility, about how can Vallejo do a more comprehensive job of supporting women when they are released, helping them get hooked up with social and health and mental health services, addiction services, whatever they may need, and kind of, in a way, strengthen that safety net when the women are discharged back to the community. And so those talks are going very well, and looking at some new partnerships there. With the Topeka Housing Authority, big shout out to Arnold and Sophie for opening their doors to talk about additional ways that mental health centers can support people who live in public housing, and just a couple of exciting things going on there, including offering some training for the Topeka Housing Authority staff and ongoing consultations and things like that. One of those new partnerships, well, not new, but a renewed and re-energized partnerships we're pretty excited about. Did provide legislative testimony Committee testimony. Let's see, the weeks and months are clicking by. I guess that was back in late February, and went in with KDADS, who is our state funding and licensing partner, to talk about the adult continuum of care. In other words, what is that range of outpatient and inpatient services, residential services that adults with mentally ill need in order to recover and adjust in the community, rather than be put in a hospital. And went in and testified to the Social Services Budget Committee about the needs of along the way, along the continuum. So had a good conversation with our legislators there. We'll comment real quickly on State Hospital. You've probably heard on the news. There is a pretty solid plan in place to restore those 60 beds. At Osawatomie, that's a little under a third of the 206 beds that have traditionally been there. And those beds are sorely needed, as you may have heard from other local health providers and social services providers. Those lack of beds back up on a community, particularly an urban community and a kind of a healthcare center, if you will, like Shawnee County is. And so I will say, hats off to the state in terms of putting together a good plan to get those beds restored and recertified. We hope that will happen by sometime this summer. I think that's their goal. So there is a good plan in place. And in the meantime, though, just lots of work in terms of providing crisis and services that can divert people from the hospital, finding other local hospital beds like the Stonewall Vale. They've been a great partner to us there. And our own overnight crisis center that we built a couple of years ago has been pretty busy, as you might imagine. Just a general comment, number 7, about kind of already done that, collaborating with other healthcare providers. When I got here, I saw a lot of good partnerships, but I also saw that maybe at Vallejo we could do a little bit more in terms of meeting with people, sitting down with people, and finding out how we can fit better into the health and social services scheme here in Shawnee County. Just in time, kind of a specific operational thing I would share with you. One of the concerns I was presented with when I got here was that it's our medication scheduling program could get a little bit busy in the morning, and it was kind of hard on people who didn't have transportation. It might be hard on people who have young kids at home or people that work. And so there's kind of an evolution in how you schedule medical patients. You do the traditional out scheduling. So here's your appointment, you come back and see the doctor in a month or 2 months or whatever. The mental health center, in fact, mental health centers all across the country moved on from that many years ago. Most of them did, because the cancellation rate is so high. You sit there with a licensed medical provider, and the person doesn't show up for 20 minutes. And it's a big financial hole. And plus, 2 people don't get care. The one that didn't show and the one who could have had that appointment. So some years back, mental health centers across the country began to move to what's called same-day access. So about the time your medicine runs out, you call in, you call the mental health center, you call by a certain time, we will see you that day. It's pretty handy. No-show rate is about 0 to 5%. It's really, really low. It's a big money saver. And it works for a lot of people, but some people just can't, stop what they're doing and come and see a physician at 2 o'clock in the afternoon once they've called in and found out what time to be seen that day. So the system was a big money saver for the mental health center. It helped a lot of people. But it can be a little confusing and challenging. People have to work, transportation, childcare problems, who are ill maybe. And so what we've moved to is called just in time. What happens is when a person gets their medicine, they're told to call in within a certain amount in a certain period of time, in a month or 2 months or whatever. And then when they call, they're given their own personal appointment within 3 to 5 days of their phone call. So if they can come in that day, the next day, 2 days later, it just works a whole lot better. We started that April 1st, and so far seems to be working pretty well. And so the built-in control there is if the individual doesn't call, we call them and remind them of their appointment, because we don't want somebody to miss their medication appointment. It's one of those things that can lead to a crisis. And so we think that just-in-time is going to create a much better patient experience and keep our no-show rate down around 4 or 5%. So with that, I'll conclude my remarks. If you have any questions, I'd be glad to stand. Thank you.
I don't think I have any questions, commissioners. Any questions or comments?
If I may, Madam Chair. Thank you, Bill, for the update.
Welcome.
I know a lot of times that we don't hear from our community partners until it's budget time. So it's nice to have an update from one of our community partners. I did notice in your financials, under net patient revenue for the month of March, you were 116,000
Yep.
variance, and year-to-date, 414,000.
Yes.
variance year to date. Have you identified the reasons that net patient revenue is down so significantly?
We have, and if I was going to single out anything in that report, it would be line number 11. Several, it's pretty complex. Several things are going on. The state implemented a new, well, of course, our biggest revenue streams is Medicaid, and any kind of wiggle in Medicaid payments or policy or rates or anything like that, can create either a really positive or really negative impact on us. And so I think it was maybe last summer the state implemented a new eligibility system. In other words, when a person goes to apply for state benefits, federal benefits, whatever, there's an eligibility system, kind of a vetting process they have to go through. And they put a new software, a new procedure in place, and that slowed things way down. I think they've got that fixed. The Department of Health and Environment's been working pretty hard on that, but you've probably seen some press about nursing homes that can't get paid, doctors, dentists, mental health centers, other providers who have gone weeks or months without payment. We have had some people who have had their Medicaid benefit in place and for no reason they've been dropped. So what happens in our particular case is when a person qualifies for Medicaid but they can't get it, or if they have Medicaid and they lose it, we continue to see them anyway. We write off just tons of money in charitable care every year. And so that has that's one thing that hurt our bottom line. I don't have an exact figure, but at one point we were thinking about $150,000. And that would have been maybe for the January, February period. So if that was working better, I think our cash position would look better. We will get some of that money. Some of it may just be gone. The other tough part of that is it makes it difficult for people to get services elsewhere. But because of the Mental Health Center's charter and our license and our public duty, we continue to see those people anyway. So the other thing that happened is that's going on is there's kind of a change in the way Medicaid views certain codes, crisis billing for overnight care, what we call psychosocial groups, which is kind of a long-term for day treatment. There have been some changes in policy and how actively we can bill in that area. And so, it's kind of some managed care procedures that maybe tamped down billings in some area and has affected our revenue. And we've been able to offset that by reducing expenses and looking for business opportunities in other areas, but there are no immediate, really profitable things there in the future. But that's kind of one of that opportunities plan we're working on. So you can see we've compensated by reducing expenses and cutting where we can, trying not to spend. I will say that one area that we're going to be losing, a program we're going to be losing come the 1st of July is called Health Homes, not home health, but Health Homes. It's a Medicaid program where we take a person on Medicaid benefits who has health problems and work with other medical providers to maintain or restore the individual's health. It helps bend that Medicaid cost curve. But a healthier covered life is a less expensive covered life, and so there's a win for everybody when a person has any kind of health insurance and they're healthy. We're going to be losing that program. And that program is a win-win-win. It's a win for the taxpayers and a win for the mental health centers, and most of all, it's a win for the patients who got better care. Their blood pressures went down, their weight was reduced, their blood sugar levels, which I don't know a whole lot about, Alice can tell you. Some really good health measure signs. And the program had been, by the time they terminated, would have been in place about 19 or 20 months, really not long enough to get the full effect. But budgets being what they are, so I'm pretty sure it's a hard program to maintain. But it is one of those long view programs where if we can spend some money now, we can save some later. That's going to hurt the mental health center financially to lose that revenue, to lose that income source. So not reflected here because we are still generating income from that, but it's one thing I wanted to kind of let you know that's coming for the future. We know it's going to be a hit, a financial hit. But even with that, we think we've identified some savings and some possible new revenue sources to see if we can't sustain ourselves for a while.
Yeah. Thank you, Bill. Again, I appreciate the update. Thank you, Madam Chair.
Well, and I appreciate you and members of your board being here as well. And anytime we can bring awareness to what's being done locally for mental health, I think it's a good thing. So
Appreciate that.
I would just note that if you want to get this report to us earlier, like the Thursday before
okay.
the meeting, that we can get it into our packet.
Will do.
And then that way that exposure to more people, so
Sure enough.
very much
And
appreciated.
I do have three extra copies here. If anybody wants electronically, we'd be glad to share it with them. Have passed some copies around, so
Great.
I'll do that as time goes by. I should appreciate that. And I
Thank
think
you.
the one good thing you guys can do for behavioral health is to talk about it, and listen to your constituents, and let's make it part of the public policy agenda.
Exactly.
So it's just one of the best things you all can do, so thank you so much.
Thank you.
Take care.
Item 3, consent agenda.
Are there questions on the consent agenda?
I would move for approval of the consent agenda as presented.
There's a motion by Commissioner Cook,
Second.
second by Commissioner Archer. All in favor say aye. Anyone opposed? Motion carries 3-0.
Item 4, new business. A, County Clerk, number 1, consider all voucher payments.
Madam Chair, this morning we have one set of vouchers dated April 15th, 2016. Total amount $1,047,793.03. Significant items in the voucher report include holding accounts for the Department of Revenue of $471,000 and health insurance premiums for approximately $325,000. I've reviewed the vouchers. Questions have been answered, and I'll make a motion to approve as presented.
Thank you. There's a motion by Commissioner Archer,
Second.
second by Commissioner Cook to approve the vouchers. All of those in favor say aye. Anyone opposed? Motion carries 3-0.
Item A2, consider correction orders.
I'll move approval. Is there a second?
Second.
Second by Commissioner Archer. All in favor say aye. Anyone opposed? Motion carries 3-0.
Item B, District Attorney, number 1, consider authorization and execution of contract C-109-2016 with the Kansas Military Board for lease of office space for 5 years, beginning April 1, 2016, and ending March 31st, 2020, to be paid in quarterly installments in the amount of $3,423.75.
Good morning, District Attorney Chad Taylor.
Good morning.
Any questions?
Just a question, and I'll have this for Jonathan. It's asking authorization and execution for us to approve, but I'm under the impression that we need to acknowledge
That would be correct.
the contract.
Correct. So then that way the Madam Clerk can pay our bills.
Okay.
Because it's over $1,500.
Okay.
And since he's a state officer, we wouldn't be signing the contract. So I didn't approve it for formal legality either, so.
Okay. Any comments you want to have on the item?
No,
or-
I agree with everything the county counselor said.
Okay. Questions, commissioners?
I would move to acknowledge receipt of a document from the District Attorney's Office regarding lease of space.
Thank you.
I'll
Motion
second.
By Commissioner Cook, second by Commissioner Archer. All in favor say aye. Anyone opposed? Motion carries 3-0.
Thank you very much.
Item C, corrections, number 1, consider authorization and execution of contract C-110-2016 with PCI Mechanical Services for service and materials associated with preventive maintenance to the department's heating, ventilating, and air conditioning equipment. Excludes the new rooftop HVAC unit at a cost of $4,523.
Good morning, Commissioners. Brian Cole, Department of Corrections. This is an annual contract that we have for the upkeep of our HVAC system. This is a contract that we budget for every year. This is a very reliable company that we've had for several years, and each year we do look out at our contracts for who can provide the best service at the best cost, and PCI Mechanical Services has been very good for us. We have several, almost 14 separate pieces of equipment provided, so this is a very important contract for us, and I'd be happy to answer any questions you may have.
Thanks, Brian. Questions of the contract? Not, I'll move approval. Is there a second?
Second.
Second by Commissioner Cook. All in favor say aye. Anyone opposed? Motion carries 3-0.
Item C2, consider authorization and execution of contract C-111-2016 with Tyler Technologies, Inc. to provide 16 additional hours of training and assistance for the Department of Corrections build team at a cost of $2,640.
Brian Cole, Department of Corrections again. This is a contract for training for our department that when we started working years ago regarding the New World System implementation, we put together a build team or a training team that would train all of our staff at the jail, which is approximately about almost 300 staff. This was when we thought the implementation was going to happen over 2 years ago. It is not, and then now we're in the throes of getting it going, and a lot of the people that went through the training have had some issues with retention of what was going on, and had asked if we could have New York come back in and train, so we can get everybody adequately trained. We have the money in the Department of Corrections training budget. I feel this is very valuable, that we can make sure with this new change we understand what's going on, that we understand how to be efficient with the program, to make sure that we're doing it right, and I think we owe it to our build team, in my opinion, to be able to get them the adequate training to bring them back up to speed, which has been almost a 2-year delay.
Thanks, Brian. Other questions?
Move to approve the contract.
So motion by Commissioner Archer,
Second.
second by Commissioner Cook. All in favor say aye. Anyone opposed? Motion carries 3-0.
Thank you very much.
Thank you.
Item D, facilities maintenance. Number 1, consider approval of request to add a wireless data plan to the existing Verizon contract for use by the facilities maintenance director at a monthly cost of $29.39.
Good morning, Commissioners. Bill Cole, Facilities Maintenance Director. This gives me a cell phone so that people can get in touch with me when they need me. There is no cost for the phone itself, just the wireless data plan.
Okay, thank you. Questions?
Move for approval.
Motion by Commissioner Cook.
Yeah, I'll second.
Second by Commissioner Archer. All in favor say aye. Anyone opposed? Motion carries 3-0.
Thank you.
You're welcome.
Item E, Parks and Recreation. Number 1, consider approval of request to reject all bids received for printing of the summer and fall issues of the guide, and to resubmit solicitation for this service.
Excuse me. Good morning, Commissioners. John Knight, Parks and Recreation. As the memorandum in front of you says, recently we went up to get bids on the guide. We got 2 bids that came back. When those, after the purchasing department collects those bids, they come back to staff, and staff reviews those. Unanimous from the staff was they would like to expand the scope and go out for more, because one of the bids that came back was a little more than twice what we're used to paying, and the other one, the sample artwork that they provided to us was poor quality. With that, Mike McLaughlin and I are both here to answer any question you may have.
Thanks, John. Is that going to delay getting out? This is for this summer?
Yeah, we can still make that schedule. That's a pretty quick turnaround process.
It is.
For it. We may be a few days delayed, but
Okay.
it's a recommendation.
All right. Questions?
Madam Chair.
Yes.
John, you're still going to have everything listed online, so that if people want to find out what's going on from Parks and Rec to meet you there, as the tagline might say, we're still able to go online and find out what's being offered.
Yeah, our big push over the last couple of years is to try to get the public to convert from this guide to a more web-based system, in which they can sign up, register, and get all the information that they want from that as well, too. So, there's still some old fogies around that like to look at the pretty pictures and the writing. Isn't that right, Mr. Cole?
Any further questions?
No. I would move for approval of the request to reject bid and resubmit.
There's a motion by Commissioner Cook.
I'll second.
Second by Commissioner Archer. All in favor say aye. Anyone opposed? Motion carries 3-0.
Thank you, Commissioner.
Item F, Commission. Number 1, consider approval of resolution number 2016-31, designating the extension of the Native Stone Scenic Byway.
And Commissioners, I believe we have Marcia Erickson with us today. Just come on up to the podium. And Sally Strathman is here also from the Scenic Byways. You just might give a brief explanation of what our role is in this.
Okay, well, of course, Shawnee County is the east end of the existing Native Stone Scenic Byway.
Mm-hmm.
We were designated in 2007, and we have elected to extend our byway. The west end ends on Highway 99, just north of Alma.
Mm-hmm.
And we have decided that we want to continue on north on Highway 99. I think I sent you a map.
Mm-hmm.
And then at K18, we'll go west into the little community of Waubonsee, and then cross the Riley County, Waubonsee County line, continue on K-18, and come out on 177 just east of Manhattan, and then go up on 176 south on 177, which will take in the Konza Prairie. And this is just it's gonna increase our byway by mileage approximately another 20 miles. But it's gonna give us the Konza Prairie and the historic part and the pre-Civil War era in Waubonsee and the Beecher Bible and Rifle Church and all of that. It will be a really good thing for our byway. But in doing this, the state of Kansas, who of course is our partner, but they kind of make the rules, we have to go back to the existing counties, and the resolution has to be amended to include that description.
So there's no changes within the byway in Shawnee County, but in the other
Right,
counties, but we
correct.
still have to approve the resolution,
That's
the amended
right.
resolution.
Just have to change the description of where it starts and where it ends.
Okay, all right. Questions, commissioners? I'll move to adopt the resolution. Is there a second?
Second.
Second by Commissioner Archer. All in favor say aye. Anyone opposed? Motion carries.
Thank you. And where will we get the resolution?
Actually, right after the meeting, I'll sign it, and the clerk
Okay,
can help you.
perfect.
Okay?
Thank you.
Thanks for being here this morning.
Yeah.
Nice to meet you both.
Item 5, administrative communications.
Administrative communications from anyone? It's a dreary Monday, rainy morning. Nobody wants to talk. Okay, commissioners?
Good to see the rain, though.
It is, definitely.
I understand that there was a tulip festival out the lake.
Mhm.
Maybe Mr. Knight might want to, Director Cole, did you hear me? Mr. Knight might want to update us on that.
Yeah, Commissioners, yesterday, we had the Tulip Festival out at Lake Shawnee's Ted Inslee Gardens. It was an emphasis put on by the Friends of Ted Inslee Gardens, which is a friends group of our foundation. They had several thousand people out there, from people wanting to partake in all the activities that were going on, to also, we had several groups out there performing. I happened to be out there when children's choir was singing. They were excellent, but they brought a lot of family members too. So there were a lot of people visiting our parks and visiting specifically Ted Inslee Gardens this past weekend that may not have.
Very good. Thank you. Commissioner Archer?
It is a rainy day, but I did want to make note that there's going to be a dedication this morning of the Bartlett and West Pocket Park on Kansas Avenue. It's going to be at 9th and Kansas. And Kansas Avenue continues to flourish with good things, infrastructure and private commitment. So I would encourage people to take an umbrella, and I'll meet you there.
Thank you.
And I hope I don't get any copyright problems by using that. Okay, thank you very much. Thank you, Madam Chair.
Sure. Okay, and I don't believe I have anything. Next item, please.
Item 6, executive session.
Is there a need? If not, we are adjourned.
Sorry, Brian,